We're going to be doing a head-to-toe assessment today. So the first thing I would do would be gather the patient's chart to determine gender and any medical conditions that might affect today's assessment. So I would gather all my equipment and determine if any PPE is needed. I would introduce myself to the patient. My name is Maria Hurtado. I'm going to be your student nurse. Can I please have your name and date of birth?
Elizabeth Hurtado, 10/24/2001.
Are you allergic to light tests?
No.
Okay, we're going to be doing a head-to-toe assessment today. And then I would perform high hygiene and give privacy to the patient. And the first thing I would do would be just observe her right now and see if there's anything out of the ordinary. And I would take vital signs, blood pressure, pulse, temperature, respiration, pain, all that. And then I would get started with asking, do you know where you are?
10 hospital.
Do you know what date it is?
August 5th.
Do you know what we're going to be doing on you today?
I had to tell assessment.
Okay, so she's oriented to the time, place, and situation. Can you touch your finger to your nose? Can you rotate your ankles? Okay. And then we get started with her down. And I would just check the texture, any lesions, anything like that. And then I would check her neck for any distensions, see if it's the symmetry and then the color of it. Next, I'm going to check her pupils. Can you follow the pen line? Can you stare at the pen light and now the wall? Pen light, wall. Okay. So then I would check your ears for drainage. And if she has hearing aids or anything like that. Can you open your mouth? And then I would check her mouth for lesions, broken tooth, anything that could get in the way of her. Can you rotate your head up? I would check her nails. They're good. And then I would get started with listening to her apical pulse for a full minute. And then I would do that for a whole minute, and I would do the same for her radial, and I would compare the two to make sure there's nothing out of that ordinary. And next, I would listen to her lung sounds. The posterior. Can you take a deep breath? Another one. And then I would do the four more on the front, and then I would listen to her back. Take a deep breath. Another one. And I would get all the 9 spots on the back as well to make sure her lungs are clear and there's nothing wrong. And then can you grab my hands and squeeze as hard as you can? Okay. Can you stick them out? Bring them in? Okay. And I would check her now, her capillary refill on both hands. Make sure they're good. And then can you lay down, please? And then I would inspect her abdomen to make sure everything's all right and there's nothing wrong. And I would listen to the 4 quarters. And then I would palpate to feel any firmness or any masses or anything. And then I would check her popliteal pulses back here, and then her tibial, and then her dorsal. Can you push against my hands? Okay. Over here. And then can you? And then. Okay. And everything seems normal, so you can sit back up. And and I would put the bed in the lowest position with the wheels locked, Cabo within reach, ask if she needs anything. I would perform hand hygiene, and then I would document all the findings today and abnormal findings, and I would report them to the physician.